So thank you very much, Chris, for your talk about the patterns of presentation of benign tumours today. I just have a few questions to ask you. First of all, the obvious question, what is a benign tumour?
So tumours can either be benign or malignant. So a malignant tumour is a cancerous tumour. That's a tumour that can grow and cause problems, potentially problems elsewhere in the body. A benign tumour is, they can still grow, but they tend to stay locally and they just cause problems in the area that they first present.
Okay. And can they be difficult to diagnose?
They can be difficult to diagnose, yes, particularly in the nail, because they can present in all sorts of ways dependent on where they are. Some of them can present beneath the nail, some of them can present on the skin around the nail, and some on the sides of the nail, and some of them present by a change on the surface of the nail. So they can be a whole range of ways of presenting.
Okay. And so they're benign, so they're not malignant, but can they still cause problems?
Yes, you've got some that can cause pain. You've got some that can disturb your function, so that if you're trying to use your hand, your nail can catch. You've got others that can increase in size, and so they impair your ability to do things. So yeah, they in many cases people as long as they know they're harmless are happy. But in some cases they can cause symptoms.
Okay. And so in that case, sometimes when they cause problems for the person, what are the treatment options they can?
It depends on the type of tumour, and it depends on whereabouts it is around the nail. For example, in some cases you've got growths of the bone beneath the nail, then if that's causing pain you have to trim the bone back, which sounds quite radical. In other cases it's problems with a growth coming from the joint at the end of your finger. In that case, if that's causing problems, you need to identify where that connection is with the joint and tie it off. In other cases, if you've got little tumours that are growing within the nail and they're causing pain, then you have to try and find them and cut them out.
Okay, that's very interesting. And lastly, my last question, what should someone do if they suspect that there's something wrong with their nail and they're not quite sure if it's benign or not, and who should they go and see?
I think initially, we always say it, but initially you have to see your GP. You have to see your GP and give them a history about what's been happening, how long it's been there for. Very importantly, is it changing? Because if something is in an isolated finger or toe and it's growing and it's changing, then that probably needs to be seen to make sure that it's nothing serious.
Brilliant. Thank you very much.